All right, this will be the first quiz for the posterior side of the lower extremity. So just like the other ones, pause if you need more time. Once we're done going over all the answers, you can stop the video, look over your answers. When you're ready, hit play again, then we'll go over the correct answers together. All right, let's start. Number one. Up here, we're gonna be in the gluteal region here. And let me grab my probes. There we go. All right, so in this region here, I want you to identify this large muscle that we've cut. You can see both sides of it there. But number one is identify that large muscle right there. That's one. Number two, we're going to take number one, and I'm just going to reflect it like this, and we can see this all through here. So for number two, I want you to identify this vessel that we can see here. You can also see it down here, this whole thing. Identify that vessel there. That's number two. Number three is we're gonna keep this muscle up out of the way. I'm gonna grab these guys and just move them up. Whoops. It's just a little bit like that. All right, so in this area here, we have 1, 2, 3, 4, 5, and then if we move 5 here, 6th muscle down there, and I want you to identify that 6th one that's in there, that's in between 4 and 5 down there. Identify that muscle. That was number three. Number four, we're gonna move down to the back of the knee. So we come down over here. We're gonna take these calf muscles and we're just gonna reflect that out of the way there. I'm gonna take this other cut part and just kind of bring that up like that. And right, is that gonna stay? No, that will stay. All right, I'm gonna hold this. And in this area, I want you to identify this flat muscle that I'm outlining right there that crosses the back of the knee, the way I have the probe here. Identify that flat muscle right there. That's four. Number five, we're gonna come back up into the gluteal region. So back up here. We're gonna take that muscle that we already identified, move it out of the way. And right here, actually I'm gonna come over to your side for a second so I can make sure I'm pointing to the right thing. So if we kind of key into this muscle here, this muscle, we have some vessels. Kind of move this over a little bit, like that. You can see some vessels coming up here and going right here that I have under there. Vessels emerging. I want to know what are all of these vessels called that emerge on this side of that muscle. Those vessels. That's number five. Number six, we're gonna move down and let's switch sides. We're gonna move down to posterior leg here, and we're gonna take these muscles here and we're gonna reflect them like that. So in this area, I'm gonna move this a little bit here, kind of tuck that in. So right in this area, we have three muscles. 1, 2, 3 muscles there. I want you to identify of those three, the first one, that muscle right there, where you can see the muscle belly for it. Kind of move this over a little bit, is like right here. So you see how these guys crisscross a little bit. So there's the muscle belly, there's the tendon. Follow that down, and that tendon is gonna end over here on the medial side of the foot under these muscles here. Identify that one right there. That is number 6. Number 7, right next to it. So we're going back to the same spot. Again, we got 1, 2, 3 muscles. Now we want to identify this third muscle right here. So this whole thing that we can see there, if we follow it down to the bottom of the foot, it would connect to this tendon here, and that would go down to that digit right there. identify that muscle. That's 7. Number 8. Is down here. So we're going to go down to the bottom of the foot here, right? We're going to take this and we're going to reflect it. We are going to take this little bit of vasculature. Actually, just let me grab another thing here. So we're going to grab this vasculature and move it over that way, kind of like that. And we're going to take this stuff and move it over this way, like that. We're going to open up this little window. Now in here, let's see if that'll stay. Yeah, that's good. We've got these two muscles here. So I'm kind of right in between two things. We have a muscle right here, and then we have another muscle or another part of it there. So we got these two parts of this muscle. Out of those two parts, I want you to identify this part of it, which is going this way, like that. That part right there of that whole muscle. That's number 8. Number 9, we're going to be up here. So let's just turn this a little bit like that, right? So we have these vessels that emerge on the posterior side of the thigh. We're going to follow this one down, right? So it crosses behind the knee. We're going to kind of move this stuff out of the way. So we're following this guy down. Comes down here behind the knee. We can see it. Can you see it here? Right? Mm-hmm. Follow that right down. And actually, let me go this way with it. Right? So here we're on that same vessel. Now, right here, if I lift up, hopefully, can you see that split there? Here, here? Mm-hmm. Okay. So we're going to stay on this side. We're going to follow that down to right here. And we can see I'm right in between a fork right there. And I want you to name this branch, which is going that way, all right? That branch right there. That's number 9. Number 10, we're gonna go back down to the bottom of the foot. All right, we're gonna take, let me get this out of the way. Let's take this and put that back there, right? So we got this piece of connective tissue. We have these two regions on either side. We're going to stay over on this side, and I'm going to just create a little bit of space here. So let's grab this guy right there, right there. So right here, if we kind of open this up, in this region, we got two muscles there. I want you to identify this one, the more lateral one. Here, and if you follow that one down, it's going to attach right there. All right, that muscle there attaching there. That was number 10. Number 11, in the same spot, we're going to now take this, we're going to reflect it, and we uncover this area right here. Now I'm going to grab this tendon. We kind of use this tendon here as a landmark, right? So we follow that tendon down. We can see it splits there, 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 there. And alongside of those tendons, we have muscles. This one, that one, that one, and that one. Those. And I want to know what the name of those 4 muscles there are. 1, 2, 3, 4. What the name of those 4 muscles are. That's 11. Number 12, I think come around to this side. So here now we're looking at the lateral side of the posterior leg. And over here, running along this side, we have 2 muscles. We have one we can lift up there, and if we move that one out of the way, we have this muscle that's located deep to it. So we kind of have 1, 2 muscles there. I want you to identify the more superficial one here. So we can see, trace it down, 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 and these 2 cross on this side of the foot to end over here. Right, and I want you to identify this one. That was number 12. Number 13 is, and I guess you want to be this way here, is, all right, so we're gonna have this guy here. All right, so if we follow down, we got an artery and a vein traveling down posterior leg right here. So we follow that down, 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 and right here, you see the probe is right in between. I'll actually stick it out that way. It's right in between a fork that we can see right there and there. I want you to identify this side of it, which travels under this muscle, and then we can see it pop out again right here, and it goes down along this side of the foot over there. So again, from here, we got a split right there. I want this side of it, which continues down over here. Identify that vessel. That's 13. Number 14, you're gonna wanna look that way. So for here on posterior thigh, we can see we have these muscles here, right? And we can see that we split here. We're gonna go down posterior lateral side, and I'm gonna grab this muscle, I'm gonna lift it up, and you can see these two muscles joining together right there. And of those two, I want you to identify this one. Right there. That muscle there. That's number 14. Number 15 is down here, and that is looking at the ankle joint here. I want you to identify this bony process that sticks out on that side of the ankle right there. That bony process. That's 15. Number 16 is we're gonna look over here on the lateral side of the thigh. So let's put this muscle back. Let's take this fascia and kind of pull this back up here. And I wanna know, what is this piece of connective tissue called that runs up and down on the lateral side of the thigh? Right along there. That piece of connective tissue. That was 16. Number 17, I want you to name two muscles that attach to your answer for 16. There are two muscles that attach to this piece of connective tissue. Name both of those muscles. That was for 17. And then for 18, I'm gonna show you a movement and you're gonna name it, all right? So for number 18, I'm gonna stand like this, anatomical position, and I want you to name this movement. Start here, end here, like that. Begin here, end there. And I'll just face to the side so you can see. So start here, end there, like that. So name that movement, all right? That is number 18. Number 19, you can just keep it on me because we're gonna, the rest of them are all about that. So number 19, I want you to name the plane that 18 occurs in. So again, 18 is start here, end there, right? Start here, end here. So name the plane that that movement occurs in. That's number 19. And then for number 20, I want you to name 3 muscles that can perform the movement you put down for 18. Name 3 muscles that can perform number 18. That's for 20. And then for 21, we're going to name 2 muscles that would act as stabilizers while we're doing the movement for number 18. So again, we're going to do this movement here, and we want two muscles that would act as stabilizer muscles here. Now, think when we're doing stabilizer muscles, these are ones that you're thinking balance, ones that would preserve balance while I'm doing this movement. All right, two muscles that would act as stabilizers. And that would be for number 21. And that's all the questions. All right, so pause so you give yourself some time to go over your answers, make sure you have everything. When you're done, hit play again, we'll go over the correct answers. All right, number one, we'll go back up in the gluteal region, and the first one was nice and easy. Identify this big muscle there, that was gluteus maximus. That was one. Then for number two, we took gluteus maximus and we reflected it. So we opened this up and we want to know what this vessel here is that's located under gluteus maximus that we could also see down here going down the middle of the posterior thigh, and that is sciatic nerve. Then number three, we're up here under gluteus maximus and we went into the hip stabilizer muscles here. So again, we have 6 of them in this area. 1, 2, 3, 4, 5, 6 down there. And we wanted that 6th one that we've exposed a little bit, and that's going to be obturator externus. Then for number 4, we moved down to the back of the knee. So we took gastrocnemius, we reflected it, and you can see that we cut the medial head of gastroc here. So I moved that, let that stay over there. We picked up that medial head here, and whoops, hold that. And then we wanted to know what was the name of this flat muscle here that crosses the back of the knee like that, and that's popliteus. Number 5, back up in the glutes here, is we moved gluteus maximus again. We kind of keyed into the first hip stabilizer, which is piriformis, and I wanted to know what are the name of these vessels that we can see here and kind of going down this way like that. What are the names of these vessels that emerge above piriformis? And that is going to be superior gluteal arteries and veins. There's nerves in there as well, but superior gluteal vessels, arteries, veins, nerves. That was 5. Number 6, let's switch. All right, 6 was, we take the calf muscles, so we got gastroc and plantaris, soleus, move them out of the way. We're over here in the medial, posterior medial leg muscles, and we have 3 next to each other here, and I wanted you to identify that first one. You can see the tendon there. If we kind of open this up a little bit, you can see the contractile part here, right? And that one ended over medial side of the foot under these muscles, and that was going to be tibialis posterior. Then for number 7, same spot, we went from tibialis posterior past the second muscle to the third one, which you can see all the way along here. And then we followed that guy down to this tendon here over towards the big toe, and that's going to be flexor hallucis longus. Then for number 8, we went down to the bottom of the foot and we moved the plantar aponeurosis out of the way along with flexor digitorum brevis. And then we took, just move this vasculature over here like that. And then we took basically the tendon for flexor digitorum longus and the lumbrical muscles and everything. We kind of moved those guys out of the way. And right here, we exposed this muscle. So kind of right in between the 2 parts of this muscle here. This part, that part. This is adductor hallucis, and specifically I wanted that part of it there, which is the transverse head of adductor hallucis. Then for number 9, this one, we came back up on the back of the knee and we're following down some vasculature here. So we started with these vessels that emerge in the back of the knee. These are your popliteal vessels. Specifically, we kind of looked at the popliteal artery. And we follow that down past the back of the knee in here to right there, right to here. This is still popliteal. And then right here, we kind of lifted this up to where we could see, hold that up, we can see this split here, and that is popliteal splitting into anterior, posterior tibial. We stayed on posterior tibial to right there, okay? And then we can see this branch coming off on the lateral side, this one right here, and that is going to be your fibular artery. That's the one we asked, fibular artery. Then number 10 was back down at the bottom of the foot. Came back down here, kind of put the plantar aponeurosis back in place. We wanted to look over here in this region, which is that lateral plantar eminence. And then within the eminence, if we just create a little space like that, we can see here that we kind of have 1, 2 muscles. Kind of just highlight that, right? So we got 2 muscles next to each other. We want the more lateral one, which is going to be abductor digiti minimi, which goes all the way down, went down to that little toe there. That was 10. Number 11, what we're gonna do is take the plantar aponeurosis and flexor digitorum brevis, move it out of the way. We kind of highlighted this tendon here, which is the tendon for flexor digitorum longus. We follow it down, we see that tendon split as it's going out to digits 2 through 5. And then we have muscles located alongside of those tendons, and we wanted to know the name. Those are the lumbrical muscles. So we had first, second, third, fourth. I didn't ask you to specify, just all of them, lumbrical muscles. Number 12 is over, we could come back over here, right? That was over on the lateral side. So we come over here, we're on the lateral side of the posterior leg, and we had 2 muscles. One, move that one, 2 muscles. We wanted the one that was more superficial here, and that was going to be fibularis longus. That was 12. Number 13. So you're going to want to move down a little bit. That was down here, right? So we kind of move this, get that out of the way. And we followed down this artery and vein bundle that's running down the posterior leg. This is going to be your posterior tibial artery and vein. And if we follow that all the way down to right as it's about to cross the ankle right here, we get right in between and we can see a split. And that is posterior tibial splitting into your medial and lateral plantar artery and veins. And we followed this side over here, which is going over towards the lateral side. So that was going to be your lateral plantar artery and vein, lateral plantar. Number 14 was back up in the posterior thigh area, right? So we kind of highlighted the hamstrings here, and we wanted to, we can see that the hamstring split. We have some on the posterior medial, posterior lateral. We went lateral. And we lifted up this right here. So if we kind of lift this up, we can see here, 2 muscles joining together, and we wanted this deeper one there. And that is going to be the short head of biceps femoris. So I'm holding the long head. I wanted you to identify the short head of biceps femoris. Then for number 15, we went back down to the ankle and wanted to know what was this bony process sticking out on the medial side of the ankle joint, and that was the medial malleolus of the tibia. Then for 16, we're over here on the lateral side of the thigh, kind of moved gluteus maximus back, pulled this fascia over, and we wanted to know what was the name of this connective tissue running along the lateral aspect of the thigh. IT band, the iliotibial band, or the iliotibial tract. Then for 17, we wanted to identify or name 2 muscles that connect to the IT band. One of those muscles is the one we can see right here, which is gluteus maximus, that attaches to the IT band. Then we had one that you had to remember from the anterior side, which is the tensor fascia latae muscle that also attaches to the IT band from the anterior side. Then for number 18, those are the movements again, right? So name this movement. That was going to be flexion of the thigh at the hip. And now I did it on the left side, right? You could have said right, could have said left, but you do need to pick a side there. When I'm showing just one side activating, then you're going to name that side, right? So this is flexion of the left thigh at the hip. That's what we did. Then for number 19, we wanted to know what plane does that occur in, right? And anytime we're moving anterior to posterior, then it's going to be in the anterior posterior plane or the sagittal plane. That was 19. Then number 20 is we want to name 3 muscles that can perform flexion of the thigh at the hip. So you can pick any hip flexor. So we could have said psoas major, iliacus, rectus femoris, sartorius, anything like that would have done flexion of the thigh at the hip. So pick 3 of those. And then for 21, we wanted 2 muscles that act as stabilizers while we're doing this movement. Okay, so when we're thinking about stabilization, we need to think about balance. So as soon as I pick up my left foot, and now I'm flexing that left thigh, my left foot's off the ground, right? I now want to fall to the left. That's one way, right? So we can correct for that, right? So I need a muscle, something on the right side of my body that will keep me from falling to the left. So I could use a hip abductor on the right side. That will kind of bend me over to the right a little bit, stop me from falling to the left. You also could bend your spine. So we could go back to the first half and think about a spinal muscle where I could do lateral flexion of the spine to the right that keep me from falling to the left. I could go down to my ankle joint, okay? As soon as I pick up my left foot and I want to fall to the right, I could use an everter on my ankle joint on the right side that would lean me out this way a little bit so I don't fall to the left. So anything that fits those areas, right? So you want to think about muscles that cross those joints, and there's a lot of things, right? The other way is, I'm going to turn so you can see this better here. As soon as I pick up my left foot, I also want to fall anteriorly, right? I've shifted my center of gravity forward anteriorly, and I want to go that way, right? So balance would require me to have something on the posterior side of my body that's going to pull me posteriorly a little bit so I don't fall forward. So any hip extensor, but it's going to have to be on the right side, right? Because as soon as my left foot's not in contact with the ground, activating anything on my left side is not going to help me balance, right? You need to do things on the right. So a right side hip extensor would work. A right side spinal extensor would work. The other thing is I could go down to my ankle joint again, right? If I plantar flex, that's going to push me posteriorly, which would stop me from going anteriorly, right? So something that does plantar flexion at the ankle, something that does extension of the hip or extension of the spine, right? Any of those things on the right side would work. So again, lots of choices there, and I'm not going to name every single one of them, but anything that works there would be good.